You did talk about administrative costs, and you talked about, fraud and waste in particular. I'll skip over fraud for just a second, but focus on waste. I don't think it's any big stretch to say that if AI is put into healthcare at a meaningful level, and when I mean meaningful, I mean really, let's give an example, radiology, right? Like, I don't think it's a big stretch to say that if you really put AI in over time and took off the reins, even though you're monitoring it, you really let it sort of seep into the human function side of healthcare operations. I don't think it's a big stretch to say people may want to be concerned for their jobs. I don't think it's going to eliminate 50%, but I don't necessarily think I would take the same approach of IBM, which was, oh, no, we're not replacing jobs with this. This is intelligent augmentation. We're keeping jobs. We're making people better. That's true. But look, when you're looking at costs, right? And as you said before, and I agree with you wholeheartedly, when you're talking about crisis where we're in now, don't we owe it to America in bringing down costs to look at AI as a real driver of replacing, let's be honest about it, just in keeping with candor, one of the more expensive costs that we're going to have, which is human costs, right? So to me, I'd like to get your thoughts on that. Everybody seems to be bashful about talking about it, and I don't want to be flippant. But look, I mean, the fact of the matter is it costs a lot to employ people. It costs a lot to pay for their benefits. And accuracy can be questioned, particularly in manual processes. Why shouldn't we be looking at implementing AI to the point where we can replace jobs, not with a smile on our face, but maybe with real cost results? I'd like to get your input on that.
Well, I think it's a very interesting question in the sense of I've been asked to speak many times on the future of AI in healthcare, and it's such a broad topic. I always say, well, just imagine if you were asked 30 or 40 years ago, what are computers in medicine going to do? Right. Are computers in medicine going to take away jobs from everyone? Are they going to, because AI is really, I think, just the next level of that evolution. And the way I think about it is that at this point in time, it's really about improving, some examples of where I see AI in healthcare include improving efficiency and top of license performance. How can we have AI tools remove some of the lower expertise work, yes, some of the more mundane work, because that's around the level of what it's capable of doing now. So for example, when I was a fellow at NYU, we were just starting to do the lung CT screenings for patients who had smoked a long time to look for lung cancers. And we would come in and we'd see these stacks of these chest CTs. And chest CTs, if you haven't had much experience with them, they're just these crisscross of lines of the lung, and you're looking for these little, and dots too, and you're looking for these tiny little dots. And I call it like looking for where's Waldo all day. And it's not fun. Great. It's not fun. Okay. There's nothing interesting. I'm sure I'm going to offend a few hardcore chest radiologists when I say this, but generally speaking, it's not that intellectually interesting. So that's where AI tools right now are kind of at that level. They can't really diagnose all the other complex lung diseases. They can't diagnose what's going on in the heart or in the soft tissues, for example, but they probably can help identify these nodules. And so I view it as more, at least in the imaging space, kind of a top of license. How can the AI help us move on to more interesting components of the work that we want to do and kind of take care of some of the lower level? Another example is natural language processing for note generation, for example. How many physicians sit there and they're not looking at the patient because they're sitting there typing in the notes? Well, AI you can record the sound and it can automatically generate notes for you, for example. Even today, the technology can do that, even though it's not widespread available yet. There are all kinds of ways in which AI can be used to identify patterns in terms of who's going to be at higher risk, for example, for developing sepsis or pneumonia or other conditions. And so that early detection will enable us to get in there and more effectively treat people. So I think that this, rather than have this, I think rather than have a unidimensional perspective on AI equals job loss for everyone, no, I think it'd be better to have an appreciation for all of the different ways in which AI can make healthcare better and make our own, as healthcare professionals, I'm now speaking as a healthcare professional, as a radiologist even, make our own experiences better and make us better at providing that care. And that's kind of where we are today. And if physicians today could focus on that and think about how can we leverage AI, let's say in the next 5 years, to do even more useful things in terms of driving value, I think that would be a better use of our time and attention.
Yeah, I definitely see your point, certainly on the clinical side for sure. And I'm well aware of the studies around the radiology end of AI now and where they're at in terms of accuracy with patterns and pattern recognition and that sort of thing. I would probably extend it even further to look at back end costs. What about registering a patient? What about, I've got a good friend, Jonathan Wick at TransUnion. I'm in the middle of his book now, and he talks about, going through and looking at the whole processes of looking at claims and seeing, are there issues with intake information? Do they match up with claims information? And will claims be denied from this? And there's all sorts of stats that show that those processes around registration, around claims, around collections, a lot of that's manually driven, Dr. Lee, and you know this better than I do. And frankly, I wonder, with administrative costs being as high as they are and costs in general, if we took clinical and kind of set it aside and certainly understanding that with quality and whatnot and value, what about the administrative side? Like, those are real costs, right? I mean, those are real costs that add into, presumably, the pricing that has to be there. So, that, I guess that's kind of my thought on this, is AI all around, but also looking at more of the manual side and where a lot of the errors are made today. What do you think about that?
Yeah, I
on
totally
the
agree with you.
administrative end?
I would much rather see fewer people in the administrative side of a health system or a payer, insurance company, office, and have more of them trained as nursing assistants to support seniors at home, more home health, more support, better support for nursing homes and assisted living facilities. And there are so many areas, rural medicine. Let's talk about the shortage of care in rural environments. I mean, there's so many, the healthcare is so unevenly distributed. Like it's hard to spend 2.5, 3 times as much as we really need to be spending probably. And so how do we recover some of that waste and redistribute it? I think that's kind of at a very, very macro level, how we should be thinking.
So well said. And while telehealth is good, telehealth ain't going to fix everything in rural America, so to speak. And I think there has to be real human-based contact and care that's not there and being filled. I just love
especially
that point.
Aging America. I'm sorry, the aging America. Rising, you look at the population, look at what happened to nursing homes in the COVID pandemic. And then you think about these individuals who, a third to a half of all individuals who are in nursing homes have at least mild cognitive impairment or some form of dementia, basically early or even not early. And that's not something that we're going to be able to manage without human touch.